Former Super Bowl winning quarterback Terry Bradshaw from the Pittsburgh Steelers revealed that he's recently been treated for both bladder cancer and a very rare form of skin cancer. I'm going to discuss this rare form of skin cancer called Merkel Cell Carcinoma. We're going to talk about the risk factors and what you need to know. I'm Dr. Dustin. I'm a board-certified dermatologist, and I have helped millions of people through social media to make better decisions about their health and their skin care. I appreciate you watching. Let's jump into the video. Terry Bradshaw won 4 Super Bowls with the Pittsburgh Steelers, and he's also a Hall of Famer. He's also quite well known now as a football announcer for Fox Sports. Recently, he was back on the job and revealed that he'd been treated for bladder cancer. I do want to take a minute and just talk about the risk factors for bladder cancer because there are modifiable risk factors or things you can do to prevent that from happening. One of the major risk factors for bladder cancer is actually smoking. You might think that primarily affects the lungs, and while smoking definitely increases your risk of lung cancer, you're also taking a lot of toxins into your body that have to be filtered out, and the kidneys dump that into the bladder where those toxins can sit before they're excreted, and over time that can increase your risk of bladder cancer. Older age also will increase your risk of bladder cancer, so the older you are, the more likely you are to have many types of cancer, including bladder cancer. Caucasian individuals are also at a higher risk than many other ethnicities. So I don't know if Terry Bradshaw was ever a smoker. I suspect he probably wasn't, but I could be wrong about that because he was a professional athlete, but certainly he is over 70 years old and he is Caucasian. Other things that we don't know about him is what kind of other chemical exposures may he have had, because certain toxic chemicals over a course of your lifetime, even at small doses, as they add up, could increase your risk of bladder cancer. Now, thankfully, this was caught, treated, and reportedly he is cancer-free from bladder cancer. But during that process, he explains that he started to feel some pain in his neck. And during that time, he went and had that investigated, and he was then diagnosed with a really rare form of skin cancer called Merkel cell. Now, when this article popped up on my newsfeed as I was scrolling through social media, I took a look at the picture and I just saw that he'd been diagnosed with skin cancer, and I saw this picture, and if you see on his nose right here, almost this triangle shape, I thought, oh, he's had a basal cell carcinoma, because that's the most common thing to happen on the nose, and it really looks like he's had a surgery on his nose and a repair, which I would call an island pedicle flap or a V to Y flap, where there was a hole right near the rim of his nose, and they took skin above that and pushed it down into place. And really overall, I think he's had a good cosmetic result here. But as I continued to read the article, it became apparent that he was actually diagnosed with Merkel cell carcinoma, which is much more rare than basal cell carcinoma or squamous cell carcinoma, and even more rare than melanoma. When it comes to skin cancer, we know that basal cell is the most common, and there's between 3 and 4 million of those diagnosed every year in the United States. Squamous cell carcinoma is the second most common, and melanoma is the third most common. Nearly 100,000 people will be diagnosed with melanoma each year. Thankfully, most of those will be caught very early, but between 8,000 to 10,000 people on average die of melanoma every single year. Those are the skin cancers you're most likely to have heard of, but have you heard of Merkel cell carcinoma? Let's talk about it. Merkel cell carcinoma is also called cutaneous neuroendocrine carcinoma, and this is something that it's been thought to come from the Merkel cells in our skin, which are an important part of our sensation, our ability to touch and sense things. However, it's actually debated if they actually come from these Merkel cells, but it does carry this name. So what are the risk factors for developing Merkel cell, and what does it look like when it pops up on the skin? So when it appears, Merkel cell often appears as a solitary bump or a nodule, so it can be small or large, and it's usually quite firm. It doesn't have the types of pigment that we expect in a melanoma, and it can grow quite rapidly. They most often appear on the head and neck, but they can appear on other areas of the body. Merkel cell carcinoma tends to affect those at more advanced ages, so 75 to 80 years old is kind of the most common age range. So that's a little bit higher than the other forms of skin cancer. It does seem to affect those who are immunocompromised more, and I'm suspicious if going through bladder cancer treatment and that immunocompromised state that would come with chemotherapy, radiation, surgery may have played a role in the development of Merkel cell carcinoma for Terry Bradshaw. It is more common in white individuals, Caucasian individuals, those of Northern European descent, than it is in any other ethnicity. There's also two other factors that can play a role in the development of Merkel cell carcinoma. The first is UV exposure. Like most other forms of skin cancer, ultraviolet light does play a role in the development of most Merkel cell carcinomas. That's why we often see them on the head and neck, because these are areas that are exposed to the sun. Another factor that contributes to some, but not all cases of Merkel cell carcinoma is a virus. It's called the Merkel cell polyomavirus. Now, this virus is something that can be on anybody's skin, but for some reason, in some individuals, in the right setting, it can help to transition into Merkel cell carcinoma. And there's not really anything you can do to prevent that, so you should protect yourself from ultraviolet light. We don't know about the polyomavirus status for Terry Bradshaw. They didn't talk about that in the article, but what we do know from the data is that those who have Merkel cell carcinoma that tests positive for the Merkel cell polyomavirus tend to do better than those that have Merkel cell carcinoma where it was negative for that virus. So if you have Merkel cell carcinoma and it tested negative for Merkel cell polyomavirus, it often is going to act more aggressively. How can you screen yourself for Merkel cell carcinoma? Well, when we have melanoma, we talk about the ABCDE rules for asymmetry, irregular borders, multiple colors, large diameter or evolution or change. And we don't have those same markers with Merkel cell carcinoma. We actually use a different system that you can look at your skin with, and we call it the AEIOUs. So the first is an asymptomatic lesion. So we have a bump that doesn't have any pain to it. It's not itchy. It doesn't have any symptoms to it. So A for asymptomatic. E stands for expanding rapidly. So something that is growing. Merkel cell carcinoma often grows quickly. I stands for an immunosuppressed patient. So when your immune system isn't functioning properly, you're more likely to get Merkel cell carcinoma as well as other types of cancers. O stands for older than 50 years. Some of these are a little bit of a stretch, but it does help to have a mnemonic. So older people tend to get Merkel cell carcinoma more frequently. So if you're watching this and you have a bump and you're 27 years old, it's probably not Merkel cell carcinoma, but if you're worried about anything, it's always a good idea to have a consultation with a board-certified dermatologist in your area. And then U, to round off the acronym here, U stands for ultraviolet light. And in an area of constant UV exposure, like the head and neck, the back of the hands, the arms, you're more likely to see Merkel cell carcinoma develop. Now, if somebody does have a Merkel cell carcinoma, it's important to know that it does have a high recurrence risk and a high risk of metastatic spread, so it can go elsewhere in the body. These tend to be quite aggressive tumors, and so even if we catch them early, we do surgery to cut them out, a person can go through chemotherapy, radiation, there is always a risk that these can come back. So we do have a report that Terry Bradshaw is cancer-free now, and we hope that he stays that way. A couple additional statistics about Merkel cell carcinoma is that 40% of them do recur, and that usually happens within the first 3 years. The survival rate there is about 60% at 5 years. So those are some quick facts about Merkel cell carcinoma and a little bit about what Terry Bradshaw has been going through. Let me know if you've heard of this cancer and if you know anybody that may have had it, and we certainly wish Terry Bradshaw well. I'm glad to hear that he's cancer-free, and I hope he continues to have close follow-up with his doctors and that he remains that way. I always have found him entertaining as a commentator on sports and Fox Sports for football, and it's, fun to watch. So never fun to hear about a bad diagnosis, and we wish him well. I appreciate you guys watching this, and let me know if you have other topics that you'd like me to cover on the channel. I've got lots of fun things coming up, and so if you found this helpful, entertaining, or educational, go ahead and share it with somebody else and bring them and introduce them to the channel. Have a great day.